Hi everyone, my name is Joseph Botello, and I'll be talking to you about the Patient Protection and Affordable Care Act, which is also known as Obamacare. And it's a United States federal statute which was signed into law by President Barack Obama in March 23, 2010, and it institutes a number of new rules regarding healthcare with the purpose of making healthcare more affordable for everyone. My major claim is Obamacare's implementation will have a significant positive outcome for America's healthcare system. I'm going to prove this to you by discussing the benefits of the Medicaid expansion and the change in healthcare policies that occur in this law. My first claim is that the Obamacare Medicaid expansion benefits all parties involved. Medicaid in the United States is a social healthcare program for families and individuals with low income and resources, and it's not to be confused with Medicare. Around half of the uninsured people in America would be covered in this expansion. This is done by increasing the federal poverty line from 100% to 133%, which means that individuals who make $11,000 or less will be moved up to $14,000 or less, so they're covered. And families of four who receive $23,000 or less will be moved up to $30,000 or less. And this increase is projected to cover 21 million people by the year 2022. The federal government will cover all costs for the first 3 years, 100%. And after those first 3 years, they will go through and continue to cover 90% of the spending all the way through 2022. And states have been projected to save money through this expansion. For example, a nonprofit organization called the Center for Healthcare Research and Transformation projected the net cost of Michigan over a 10-year period for 3 different scenarios. In all 3 different scenarios, Michigan reduced overall spending and increased the number of uninsured residents. A few of these projected savings is $504 million in the reduction in prisoner inpatient medical spending, $444 million in the increase of tax revenue from healthcare facilities and professionals, and $983 million from net state budget savings. My second claim is that healthcare policies have benefited from Obamacare. This is starting with the removal of the pre-existing conditions. And what that is defined by the University of Pittsburgh Medical Center, is that it's a medical condition that occurred before a program of health benefits went into effect. So basically people will be charged the same regardless of their medical history. And another implementation is the 10 essential benefit policies, which forces the health insurers to implement 10 policies that basically will set a standard for all healthcare providers, and anything below that is not considered healthcare insurance. And the last point I'll be making is, where all the controversy surrounds, is that all citizens are required to have healthcare insurance. Now, if you can afford this, but you choose to opt out, then you have to pay a tax penalty. And this is more of a trade-off for having no pre-existing conditions, because insurers have to cover you regardless of what you have. So you have to get insurance before you get sick, regardless. People against the mandate say it's forcing you to buy insurance, and forcing you to buy something is unconstitutional. And I disagree with this sentiment, because it's not telling people to buy a specific thing, but just to have a specific type of thing. It's just like a part of the money we pay in taxes goes to pay policemen and firemen, and they are there to protect us. This would have us paying to ensure doctors can treat us for illness and injury. And with that being said, I feel that Obamacare's implementation will have a significant positive outcome for America's healthcare system.
All right, Joseph, the proposition's clearly stated. I think you have a pretty good layout of the structure of the speech at the beginning of the presentation, so it's easy to follow. As you get to the first supporting point, you label that pretty clearly. The explanation of the expansion of Medicaid and how many more people it's going to cover is fine. I do think that you have to have a stronger explanation of the cost issue, because that seems to be the main criticism, that increasing the amount of coverage for Medicaid is being done at the expense of other programs. For instance, you said not to confuse it with Medicare, but part of the funding for the program comes from transfers of money from the Medicare system. So there is a connection there, but you need to explain how economically it's going to, in the long run, benefit us. If you're just going to focus on the health-based claims, that's okay, but then you need to leave out the cost savings that you're projecting, like in Michigan. Since you're not leaving those things out, then I think that invites an argument about the complications of how the Obamacare funding is going to be done. So you need to be a little bit more thorough on that. The argument about pre-existing conditions is clearly labeled. What isn't explained is how that's going to make things better, how it's going to improve either health care or the cost issue again. I think that's problematic. You mentioned, for instance, the 10 policy standards that are being put into place without an explanation about why what existed before was inadequate. If people had a policy that didn't meet the policy standards, why is that harmful, or what was lacking? How, and this fixes it. Well, what's the, what gets fixed? Who is covered that didn't have a coverage before? What problem is going to be addressed as a consequence of this? I don't know. I simply know that they've set standards, and obviously some of those standards are applicable to some people, but not necessarily to others. Why is it important that everybody have those standards? Again, that's one of those funding issues, because that's how everything's going to get subsidized, and I think that needs to be explained a little bit more. The constitutional issue is not really addressed in much detail. You just basically kind of give this analogy. Look, there was a court ruling on it, but the court ruling basically said that the way they get away with it is calling it a tax that punishes people for failing to adhere to the rules, as opposed to making it a mandate that it's not a law, you don't have to buy that, but there's a huge punishment if you don't buy that. That's kind of the way they circumvent that issue, and the court did uphold the punishment issue. So I'm not sure that you even need to bother with the constitutional issue for the moment. I think the bigger issues are the ones about it, whether or not it's going to improve health care and whether or not it's going to reduce costs. Those are the two main claims that were being made on its behalf, and I don't really have much data that shows that. The one piece of information that you provide is this estimate about what's going to happen in Michigan about cost savings, and I think that that's pretty good, although the explanation of how that is achieved is not particularly clear. Like I said, I think there's going to be a variety of issues that are going to come up on this, because you're simply spending a lot of money. But if you're saving money in the long run, how are you going to save that money? I'm trying to figure out. You labeled and said what all those savings were, but that doesn't tell me we're going to save this amount of money on medical professionals, blah, blah, blah. Well, how? Are they unemployed? Are they utilized less? Are they utilized more efficiently? Are they more effectively distributed because of the law? To me, that it was not very clearly explained. All right. Thank you.